Hello and welcome. Do you know what type of surgical procedure we have available to treat severe essential tremor when the medications don't do too much for you, which is very frequent? Well, this is the topic today. My name is Dr. Zayas. I am a neurologist specialized in movement disorder. So we have two types of procedure. The first one, and is the most recent, is what we call the MRI-guided ultrasound. The MRI-guided ultrasound was approved by FDA back in 2016. So with this procedure, basically you are burning, destroying one area of the brain that we call the thalamus. So when you do that, which is something permanent, you technically, basically, like I say, burning the thalamus with the ultrasound. Is very, very, very precise, very specific, high energy ultrasound. You destroy the area and decrease the tremor significantly, improving the quality of life of those patients. The problem is the only you can do one side. For example, I am a very right-handed guy. So if I have essential tremor, I will get my MRI-guided ultrasound on the left side because only work for one side. We cannot do it in both sides, at least not in 2022. Let's see what happens in the future, right? So now, the good thing about this also is that there is no incision, so nobody will open your head. But still you have side effect because it's a surgery. Even though that nobody open your head, but still is a procedure, and technically is invasive procedure without opening the head. They shave your head and they, like I say, they burn the thalamus unilaterally. Possible side effects. Well, approximately 14%, 50% of the patient might have a tingling sensation in the opposite side of the procedure. For example, if the procedure was on the left side, you might have tingling sensation on the right side of your body and face. Approximately, like I say, 14 to 50%. 7% of the patient, and you will see all this percent here, 7% of the patient might have problem with balance, which is a big deal. And approximately 3% might have a weakness in the opposite side of the brain, okay, which is definitely a big concern. The other procedure that we have available, and the one that we know the most, because has been approved for many years, I'm talking about more than 20 years, to be specific, in 1997 was approved in US. I'm talking about the deep brain stimulation, or what we call DBS, deep brain stimulation. So basically, this is a medical device that is implanted by a neurosurgeon. Usually is a neurosurgeon fellowship trained in functional neurosurgery. This is similar to, think about a pacemaker. The pacemaker, that you put a pacemaker here, but instead of going to your heart, go to your brain, specifically to a deep area in the brain that we call the thalamus. So what happened is, with this stimulation, it kind of interrupts the disorganized signal that produces the tremor, which cause a dramatic decrease in the amplitude of the tremor, leading to improved quality of life of many of patients with severe essential tremor. Remember, none of these procedures will cure the disease, none of them. And none of these procedures will slow down the progression of the disease, but dramatically improve your quality of life in the majority of the patient. We will talk later about the potential side effect of deep brain stimulation. Now, remember that it's very, very important that you select the patient correctly. And this is the most important step. Which patient will be a candidate? Not everybody will be a good candidate for this type of procedure. So the most important step is to select the patient. And this is performed by a team, by a group of professionals. For example, we need to have a neurologist, fellowship trained in movement disorder, a neurosurgeon, fellowship trained in functional neurosurgery. Also, the team includes a neuropsychologist, a physical therapist, a social worker, and a nurse coordinator. So this group meet together, they watch your videos, and they take a decision together if you are a candidate or not. So this is very important when you are planning to get this procedure. You need to get evaluated by a team. Otherwise, you are going to take a lot of risk. Another question that I have frequently in the clinic is this one here. How much the tremors improve? How much? Well, that depends of many factors, but typically we are talking about 35 to 90% improvement in the majority of the patient. Even the head tremor and the voice tremor improve significantly, but not as the hands tremor. But in order to improve the head tremor and the voice tremor, typically you need to do it bilaterally. Now, I have to tell you that if you do bilaterally, the probability of having problems with articulation, we call that dysarthria, and balance issues increase when you compare with doing just unilaterally. I will tell you what I would do. If I have severe essential tremor and I cannot control the tremors with medication, and it's obviously affecting my life and my function, and I'm very right-handed, and my tremors are here, I probably will get on one side, probably in this side only, to have a better control of the tremor here, so I can eat, I can write, I can work, I can do my stuff with my right hand. That's me. But many of the patients, I would say more than 50% of the patients will get the procedure bilaterally. Now let's talk about potential side effects. Like every surgery, you have side effects. Side effects related to the surgery, just during the surgery, are bleeding, right? They are dealing with your head, with your brain. So you can have a bleed, you can have a stroke, you can have a seizure. They might place the lead incorrectly, or when I say incorrectly, I mean a little bit outside of the target. Remember, we are talking about millimeters, okay? So putting the lead a little bit away of the target is not going to, it might not help you. It might not produce the effect that you want to. So this is one of the side effects. Technically, it's a side effect, right? So after the surgery, like every other surgery, you have the possibility of having infections, headaches. You can have depression, anxiety, apathy, problem with the equilibrium, balance issues, issues expressing yourself. So this might happen. And like I said before, it's not common because we are talking about 5% or less of the patient, they get all these side effects. Now, also, when you get the surgery, and usually you stay at home, you stay in the hospital for one day and then you go home the next day. Usually, if everything is okay, you go home the next day, and then you come back. You go to the clinic, to the movement disorder clinic, to turn on the deep brain stimulation. After 3 weeks, usually from 2 to 4 weeks, I prefer 3 weeks. So we do it in our program 3 weeks after the placement of the lead. When you stimulate this area, you can also have side effects. For example, one of the most common side effects is to have tingling sensation. So you stimulate this area and you increase the intensity of the stimulation, and you might cause tingling sensation, but this tingling sensation usually goes away even by itself, and if not, we need to decrease the intensity or decreasing the frequency, and there are other things that we can do. Also, you can have problem with the articulation, slurred speech. That might happen as well, but again, that might I can adjust the stimulation and improve those side effects. You can also, if I stimulate the motor fibers, you can have contraction, feeling like tightness of the opposite side of the stimulation, because the motor fibers are close too. So remember, everything is very close. So all these things might happen with the stimulation, but with the technology that we have available, we actually can move the stimulation away from those side effects. And there are many other ways that we can do to minimize the side effects. In summary, I think this is an excellent treatment. I think if I have essential tremor, severe essential tremor, and medications are not working for me, I will prefer deep brain stimulation. I might have my bias, but I think this is what I will get, and I probably will get unilaterally. If you like this video, don't forget to subscribe to my channel. See you soon.